On the panel, Dr. Bernice Gordon-Young presented. Pastor Patrick Randall, if you could just wave. Thank you. Denise King presented. Thank you, Denise. Annette Loderzik. Annette, can you wave? Where's Annette? Oh, she's probably manning the table for Carl. Presented on the elephant in the room, the discussion on suicide prevention. And Ryan Hobson was a presenter today. So thank you to each of you. I'm proud to say that I have the opportunity to work closely with Denise, Annette, and Ryan, who provide professional services through Trillium Place, who's an affiliate of Carl. And then also V. Is V in the room? Yes, V was a presenter, who also is with Trillium Place. So appreciate you. So we're going to transition at this time to a panel discussion. And at the end of our panel discussion, we've collected some questions from the audience that we'll try to get to. We definitely won't be able to get to all of the questions due to the sake of time. And one of the things that we've already heard loud and clear is that this discussion we need to have more of these discussions, more of these summits, and at the very least more time. And so, absolutely. And so Pastor Hubbard is already on it to make sure we continue these discussions and continue these platforms for discussions. For those of you who don't know, I'm Derrick Booth. I am the Executive Director of Community-Based Services for Carl Health. We work under the umbrella of Trillium Place. We work, yeah. And Trillium Place provides all of the community-based mental health services and substance use services, inpatient and outpatient. And you'll see many of those services on the screen. We'll kind of get into that, just sometimes knowing where to go when either you or your loved one wants help and seeking help. It's good to have those resources. And so we're just going to start from my left, from my right to my left. I want each of the panel members to introduce themselves, tell a little bit about themselves, and then we'll jump into some questions.
Hello, is this on? Yeah. I am Dr. Bernice Gordon-Young. I am a mental health provider of 28 years. I currently work several places. I'm the lead mental health provider at the Peoria County Jail, Monday through Friday. I also do some work in my private practice, primarily with individuals on parole and probation, as well as what we call high-profile clients, people who are just very visible in the community and just need an extra layer of privacy. I also work with some of our students in Peoria Public Schools who are on abeyance and struggling with substance use. I also have a nonprofit organization called It Takes a Village of Peoria, where we provide resources to help with managing and reducing some of the challenges with mental health.
Hi, I'm Dr. Kevin Thomas. I'm a clinical director of a private practice. I have a LLC of Mentality Unchained, where I do mental health literacy. Also, we do community activism work in the Rockford area. And yeah, that's me in a nutshell.
My name is Carlos Evans. I'm a school social worker. I've worked in District 150 for about 9 years, and now I'm in Dunlap Community School District. I also teach a graduate course for school social work practice class at Illinois State University. I'm very happy to be here.
So we'll just start off with a question for each of the panelists. Just share with the audience, why did you decide to become a mental health professional?
You know, I always laugh when I get asked this question. So the people who were in the breakout session, this is the truth. The truth is, I needed extra money to pay for my student loans, and there was a job I saw in the newspaper counseling parenting and pregnant teenagers in a residential group home. And because I was a teenage parent, I thought that I could help them and started working and with that population and just fell in love with the field of counseling?
For me, I kind of fell into it like you did. I started out in the geriatrics, dealing with older individuals, and someone seen me and said, "Hey, have you ever thought about, doing therapy?" And that was the last thing from my mind, because just getting out of the military, I was just thinking about just kind of relaxing, do something small, nothing heady, and they just gave me an opportunity. It's like, I think you'll be good at it. So I went back to school, and here I am 16, 17 years later. So
For me, it was a very adjacent space growing up. My mom was in foster care, and so I had a lot of experience learning about counselors, therapists who would come to the home, working with youth. I think naturally I gravitate towards youth, and so I really enjoy that work. And so to be able to create a living by supporting them, which entails supports their families, it helps them get on the trajectory of hopefully education and bettering themselves, which is how I got from where I'm from, Detroit, Michigan, to where I am today. Just wanting to give them that same type of opportunity and show them that education is the key to opening up opportunities for them as well. And so school of social work was the path that I took to be able to do that work.
That's good. What should someone do if they're concerned about their own mental health? What's some things that they could do if they're concerned about their own mental health? That's just opening one.
I would say the same thing you would do if you were concerned about your physical health. If you have a cough, if you have a fever, if you know somebody that's struggling to sleep, to get rest, you would take them to a doctor, to somebody who could support them. But it all starts with that acknowledgement that something about me is unwell.
I think the first step is to make identification, pretty much what Carlos was saying, is that you have to evaluate yourself on a daily basis. If something's different, if it's something that you're not used to, then you need to investigate that. And in investigating that, it may lead to you going to get help or just sitting and talking with someone. So you're the determinant of if you need further assistance or not.
And a follow-up to that is, what should we do if we have a loved one or a family member or a friend who we think could benefit from mental health services? How will we handle that?
I think we have to be very careful. You don't want to offend people, right? And so just being very careful. Be supportive, of course, but understand that there's levels to mental health. Sometimes people just need someone to listen. And we have to, even as mental health providers, have to be careful of not diagnosing our friends or always having that what some people perceive as being judgmental. So just being careful. Maybe identify some things. So this is just an example of, I'll just use myself for example, because I think we have to include ourselves in the discussion when we're talking about mental health, even as mental health providers. But, like someone might say, when's the last time you worked out? They're not necessarily saying you're getting fat. What they're saying is, I recognize that you're not doing the things that you typically would do to take care of yourself, So just maybe identifying some changes in a way that is respectful, so that way maybe they can start to see it, because folks won't fix what they can't identify.
And I would add on along those lines, some reflective listening too is what I've seen to be helpful, where when you're listening, being that active listener to a peer, a friend, a family member, restating it back to them, paraphrasing it back to them. So you're saying you haven't slept in a couple of days, okay? And then asking them what they think about that, because sometimes we're just in that cycle of life and we don't recognize when we're having those detachments from our normal routine, like Dr. Gordon Booth was kind of saying.
What should we do? Just a follow-up question to that, and I think many individuals may be able to relate to this. What advice can you give when we have loved ones that are in need of mental health supports? We're aware of where to take them for mental health supports or how to get them mental health supports, but they don't want the supports.
That's a big one. most people don't want to admit that they may be struggling with those challenges. And so the best thing you can do is similar to what we were already talking about, is being present with the person and being supportive, not forcing them, because when you start to force people, that's when the fight becomes. So you want to make sure that you're being patient with them. Sometimes you just need to sit with them. It may be a week, it may be longer than that. If they're not directly presenting any harm to you or anyone else, you really can't do anything. Is it when they start to present signs of harm in themselves or you, that's when you are able to do involuntary submission and stuff like that. You get into that. But for the most part, it's just being present. That's the biggest thing.
This question I'm going to direct to you, Carlos, specifically about our youth. Working primarily with youth in the school system, what are some of the areas that you're seeing being more prevalent around mental health as it relates to youth?
Yes, thank you for asking that question. Unfortunately, after the experience that we've all had with COVID, and students being outside of school or being in virtual school, a lot of social skills that they would have normally achieved by being in school, socializing, interacting with their peers, have been lost or have been a little bit delayed. And so I would say some social skill training for a lot of our students have been needed. And because some of them are aware of those deficits, it creates a level of social anxiety or anxiety generally. And then depression, of course, from not being able to access their peers and family members and get outside the home, we've seen spikes in as well. So I would say anxiety and depression for sure. But one condition that we are being more aware of assessing is autism spectrum disorder, as well as attention deficit and hyperactivity disorder. And so those are 4 of the conditions that we see a lot in the school system.
Thank you. I'm going to direct this question to you, Dr. Thomas, and you kind of touched on this during your presentation, but can you kind of expound on how mental health can have an impact on your personal relationships?
Again, what I said earlier about us as people being interdependent, we need people. We're not on an island, and you need people to be able to be healthy in society. And so when we get to the point where we're not having healthy relationships, it becomes an issue. And so having a healthy relationship is very important because it shows that you're able to live in the community. It gives you a sense of belonging. And it gives you an opportunity to have the support that you need when there are struggles. So when it comes to relationships, it's important that you foster healthy relationships. I don't say perfect relationships, but healthy relationships where people can have freedom to be expressive, where people can be honest and transparent, and they can be vulnerable. The biggest thing, especially for men, we need safe spaces where we can have these type of relationships with other men. And so, and then when it comes to your romantic relationships, even marriages and things of that nature, you have to make sure that you have to have a relationship within the marriage, because you can be married but not have a relationship.
Yeah, that's good. Dr. Gordon Young, for one of the things that you mentioned earlier as a part of your practice is that you work with individuals that either in the caring professions or professionals themselves. What advice would you give to individuals that are in the caring professions to seek out supports and services when they're in need of help?
The first thing I always say is we can't lose sight of the fact that we are human too. I never want to put myself on some type of pedestal as though I'm working with those people and I'm detached from the same challenges in life that other folks are. Yes, they may look different, but it's important that we do our own self-checks. It's important that we not feel like, oh, because I'm a therapist, or oh, because I'm a doctor, or oh, because I have this title and this position, I'm not supposed to have rough days. And normalizing that, because it is all part of life, and that things can be going well, your career is going great, and that thing happens and it can hit you like a ton of bricks. being able to model what you want from other people, right? One of the things in our training in becoming a therapist is we had to go to counseling so that you knew what it felt like, when people are asking you questions and prodding and expecting you to talk out of the house, right? Because even as therapists, some of us have been taught not to talk out of the house. So again, just recognizing that we are not immune to some of the challenges that our patients and clients and the people that we care for experience as well.
I'm going to start off this question with you, Dr. Thomas, but feel free to chime in, panel members. How do we address mental health from a spiritual perspective? Dr. Thomas.
So I've never been one to shy away from my spirituality. And so I feel that there is always opportunity to interject spirituality into counseling sessions. I think that most individuals that come into therapy is that they have a higher being. It may not be what you believe, but they do have a higher being. And so we can talk on that level. I'm careful not to push my spirituality on them, but most people come in have something that they believe in bigger than themselves. So there's a baseline there we can build on from there. And so you don't, we have to be able to relate to people, right? And we have to be able to be transparent without self-disclosing too much. But at the same time, that person believes in a higher power. I believe in a higher power. We can discuss what our higher power means in this counseling session, in this therapy session. So,
that's good. Carlos, working with youth again, what could you tell parents are some important things to either be mindful of or things to do when working with their children or parenting their children as it relates to mental health?
Absolutely. One of the things is spending time processing their day with them. And part of that looks like asking open-ended questions versus closed-ended questions. Sometimes, your son or daughter comes home from school and you're like, did your day go well? Yes, in the conversation. You might ask, did you have a good time with your friends today? Yes, in the conversation. What I've learned and what's taught to us as clinicians is to ask more open-ended questions. For example, what was the best part of your day? And that's not a yes or no question. We're going to get more feedback, more opportunities to ask probing questions or follow-up questions, and then we'll get to really get a better picture, as long as they're being honest, about their day. The other thing that I would throw out there, because we all know that social media is huge, not only for adults, but definitely for youth. And, it is filled with landmines, unfortunately, for youth to fall in, to step on. And so there are different parental safeguards that are available that we will be responsible for us to take advantage of to protect their mental, emotional, and, health overall. Because there's a lot of comparisons that happen. There's a lot of inability to detach from those platforms sometimes, and that definitely does not help with mental health for our youth, who can be kind of impressionable, fall into the mistake of comparison, and that can really lead to more anxiety, more depression that we would love to see decrease.
Dr. Gordon-Young, one of the things Dr. Thomas talked about earlier was the importance of self-care and gave the exercises of breathing as one of the examples. Can you share some other examples of self-care, or even if you could personalize it, how do you utilize self-care in your profession or just in your daily life?
It's funny because I use the bubbles too, and for myself, I really do. And in fact, if any of you all know Angel Cruz, he and I do a lot of work together. He's the case manager at the Peoria County Jail, and I bought him some bubbles. And he has the orange flavor, I have a green apple. And it's scent, because we're not drinking bubbles. But sometimes, this work isn't easy. First of all, it's not easy. This is not chit-chat sessions. We are using techniques, there are theories. Everything doesn't work for everyone, so we're considering your situation, your personality. If you're very, quiet and maybe a little meek, then that's not the time for me to pull out my assertiveness. But what do I do? First of all, I have to take care of me in order to be able to be there for you. And when I'm having that moment there specifically, because folks not always happy there, I go into my office and we are literally blowing bubbles. We are blowing bubbles. There are affirmations all around the room that says this will work out, or I can do this, or keep going. It is checking in with people that I trust to say, I'm not okay. I think that's important. I love going for rides. I love peace and quiet, right? We value that because we talk for a living. And so it's those kinds of things. It might be a funny movie. I like to be at home a lot because I'm in the community a lot. But just identifying what works for you and not forgetting about those things.
Yeah, thank you. Dr. Thomas, you're known as the traumatologist. So being known as the traumatologist, I'm going to start with you, and the others can feel free to chime in. So really a two-part question. How would you define trauma? And then how would you describe generational trauma?
Again, because of the setting, I'm just going to put it simple. Trauma is anything that you struggle to deal with on a daily basis, and it interferes with how you function. If it's interfering enough to where you can't function and it's causing some psychological and physiological issues, then that's trauma. There is a definite definition of that, but it doesn't matter at this point. Generational trauma is something that just passed on through generations. It's also passed on epigenetically, which is genetically for most people. And so it can be passed on a lot of different ways, but most important is unknown, because most people that has it and live with it don't know they have it. They just do it out of habit because they've seen it being done most of the time. And mama did it, so I can do it. Something as simple as this, I give this example quite a bit as well. Well, and my pastor talks about this as well, is that grandma taught us how to make cakes a certain way because of limited resources. And so as we get older, we're still making cakes like grandmama taught us, and we have many resources. And we're still using the small resources that we have. And so that's not a trauma, but that's how we pick up these traumas, and that's how it's easily passed along.
Yeah, that's good. That's good. We also have questions from the audience that were captured from your breakout sessions, and so I'm going to mix some of those in. We likely won't be able to get to all of them, but we are going to compile them and find a way to respond to some of the other questions that we don't get to. But what is the importance of knowing empathy versus sympathy when helping others suffering from mental health issues?
Sympathy is, in a nutshell, feeling sorry for someone. Empathy is putting yourself in someone else's shoes, recognizing that you either been there, there's a possibility that you will be there, and then being able to relate to that. And that's a bigger thing too, and I think I'm not going to speak for all of us here, but I'm pretty sure we always try to find a way to relate to people. And so having that empathy for that person that sits across from us and that we're engaging with is extremely important, that we don't come across as sympathetic, having sympathy for them, but having more of empathetic action toward them.
And I love that description. The way it was kind of taught to me for sympathy is, I'm detached from what you're experiencing. I see it, I smell it, I feel it, I hear it, but there's no walking alongside. There's no willingness to get into that deep water with you. And I think that's where empathy differentiates itself from sympathy, because I'm going in the fire with you, I'm going in that burning house, so to speak, with you, and we're gonna sit in this together and figure out how to get out together.
I always say to the people in the jail, I am one decision away from a jumpsuit. Like for real, right? Empathetic. You know, I hope to never, right? But I don't want to be that one where I was sympathetic, like, oh, you people, and now I'm in the cell with you. That's a different experience, right? Yes.
100%.
So another question for any of you is medication sometimes involved in the therapeutic process for mental health?
Yeah, medication is a tool, so based on the diagnosis, medication may not be necessary, or the level of challenge that someone is experiencing. So just always think of creating a mental health toolkit for yourself, right? And so that might have bubbles in it. That might have a bunch of different other things, but medication can be in there, particularly when we're talking about more of our significant mental health diagnosis, such as schizophrenia, where there may be auditory hallucinations. That's when, or bipolar disorder, in many cases, might require medication, as well as depression, anxiety, some of those other things. But yeah, it is a tool, but not always a requirement.
And a lot of times, where we start is not medication, or where practitioners start is not medication. Usually psychiatrists recommend medications or prescribe medications. Usually there's behavioral options you can make, or environmental changes you can make. And then psychotherapy, which is more of a communicative therapy, has a lot of different options you can pursue as well if you are a little bit nervous or leery around committing directly to a medication. And what doesn't always get talked about, especially with youth, because a lot of parents, rightfully so, are very protective of their children, their most valuable asset. You don't want your child to be perceived as some kind of lab rat, so to speak. But there is a part of the medication application that does involve changes, alterations, dosages, frequencies of taking the medication. So that is an evidence-based part of the process. So it's really good for parents to know that going in, if that is something that's indicated medically. There is evidence-based research that supports a lot of those applications. So I understand that there could be some nervousness about the medication. We don't always start there, but also there is a process, and committing to that process is really important when you want those symptoms to change or reduce.
Thank you, Carlos, for bringing that up, because I think what we have to do is not go into getting help for the sake of, I think I need medicine or medication. The fact of the matter is, I always say this: give us an opportunity first to work with you before you even put your mind set on medication. Because sometimes we can work through some of those things that you won't even need the medication. Medication is usually is good for bringing you back to your baseline, so we can work with you. And so taking medication by itself is not going to help. So you're going to have ongoing therapy as well. But most of us would like to have the opportunity first to work with the client before they go to medication. Because for me, medication is the last thing that we talk about. There is a possibility, always a possibility, but for the most part, allow us to do what we're trained to do.
There's several questions from the participants around where do you go for services, whether it's where do you go for services to talk about my own childhood traumas or just in general. And I'll just start off with the answer, and then feel free to chime in if you want. One of the things I was fortunate to learn more about in the last couple of months in my position with Carl are all the community resources that are available for not only mental health and behavioral health, but also substance use disorders in the community. And one of the things you've seen on the screen coming in, and they'll put it up at the end of the panel again, is a lot of the resources that are available, whether it's inpatient, outpatient, residential, whatever age group. There are a lot of services. Several of the presenters today are over a lot of those programs, like Denise King and and Annette, who talked about elephant in the room. And there's also programs where if you just need somewhere to go, just to be around peers and other people, like the living room, and a program called Better Days Ahead that's ran by Annette, who led the breakout session. They're available. But I would reach, we have an access center at Carl Health called, that if you just share with them what you're looking for, what you need, and they'll connect you to those services. And there are services that will be good to learn about, because a lot of times all we know sometimes is just to go to the emergency room. But there's services right there in the community that will be helpful. Anyone else want to chime in on just on several questions on where do we go when we want someone to talk to?
Speaking from the youth point of view, in education right now, especially in this community, they do a really good job at hiring school counselors, hiring folks like me, school social workers, to be a resource, to serve as a resource to the community for youth who may be dealing with some of those concerns. And so I would definitely introduce yourself to those folks in your children's schools, recognizing that, you know, there is a consent that needs to happen, you know, signed for a school counselor to spend long-term time with your child, or for even myself. And sometimes there's qualifications that have to be met before you get access to some of those services, but they are available. And there's no guarantee that you won't qualify for those services. So if you do feel like your child is displaying some different, more concerning behaviors, and you go to a local space and maybe there's a wait list, you don't have to sit in neutral and allow things to potentially deteriorate before you reach out for support at your school or place of education.
Yeah, and that's good. And one thing I also add, because he mentioned schools is also a good place to start. One of my background in Peoria Public Schools. Peoria Public Schools is very well staffed with district counselors and social workers, psychologists in the school system. And in addition to that, they not only Peoria Public Schools, but a lot of the surrounding schools partner with other agencies, such as the Children's Home with therapists, Trillium Place with therapists that are placed in many of the schools in some of the surrounding districts. So the school is also a good place to communicate and build that relationship with, to get supports for your youth as well. So one question, I'm going to come back to you, Dr. Gordon Young. We use the term stigma a lot around this topic of mental health and talking about mental health. From your experience and from your work, would you say there's a stigma around mental health, and what would that be?
I think the stigma is that we keep calling it a stigma. You know, we have to stop saying mental health stigma. Like, if everybody here stop using that term, then that will be a reduction, right? You know, I'd like to also add on, and I talked about this in the breakout room, I do my best to not say mental illness. I say mental health challenges, because I think that sends a different message.
Coming back to you, Carlos, are there resources available to teach youth about their own emotions, and how important is it for them to understand and communicate their emotional feelings?
Absolutely. And I think this is a huge one, because there was a movie that came out that really just broke this open for schools, for sure. Inside Out by Disney. That movie was so amazing. I watched it probably 10 times. My son loves it too. But the focus of it is really acknowledging how you feel, how your feelings affect your behaviors and your thoughts, like the good doctor talked about earlier. But looking at resources, there are so many books that talk about emotions and talk about your thoughts and feelings that are short for, you know, kindergarten, second, third grade level students. And there's more complex resources as well for our middle and high school youth. And so one of the authors that I know, I spend a lot of time with K-8. I don't work a whole lot in high school, but there are resources for the teenagers as well. But Diane Alber, she writes books, they call the spot books, and it's a little spot of happiness, a little spot of anxiety, a little spot of anger. And that is really useful in recognizing and validating the emotions that our children, our youth experience, versus just minimizing them and pretending like they are not valid. And it also gives them language, because we need to get kind of away from just happy, mad, sad, scared. There's so many other emotions when it comes to disgust or disappointment or discontent or dejection. There's other emotions out there. And when you can, educate your child or your youth on how to communicate how they feel, then you've empowered them to communicate with you in a way that you can understand and respond to. And so that is extremely helpful, and there's so many resources out there. Diane Albert is just one author. There are so many others. If you just spend time on a website like chat.org, which gives a lot of resources for people who have ADHD, or there's a lot of different other ones I have written down here. I didn't want to forget them, but there's other resources out there too that give you book lists that you can use and access either through a library for free, or you can purchase on Amazon or at Barnes & Noble or someplace like that. Just self-help at their level, at their reading level, that will just give them the language they need to communicate and ask for help when they come sit across from one of us and to say what they're feeling and get that validation that they may require to get the skills they need to move on and decrease symptomology.
Yeah. Just one more question before we wrap up. Two of our sessions kind of touched on this, but I know individuals not everyone were able to attend. The elephant in the room, a discussion on suicide prevention by Annette, and then also Denise talked about mental health first aid, talking about signs and symptoms. For a question for the panel, though, when someone is showing signs of being suicidal, what support can we give them around that specific area of when we know there are signs of being at risk of being suicidal? What do you suggest?
I actually just had a very similar, the actual situation. And first it was to not judge, just check in, see what's going on, and listen. And then assess, like, is this somebody who is just having a bad day or they're in a bad space and just saying, I don't want to live anymore, I don't want to be here. But I always take it seriously regardless. And knowing what the next step would be, right? And that was to take the individual to the emergency room, right? Just go ahead and, ask them if they wanted to go. Most people will say no, some people will say yes, but actually going that length and taking them to get the professional help that they need, and sometimes that is going to require inpatient care, where you're going to stay there and get treatment. So,
unfortunately, we do interface with suicidality and self-harm in schools, and a big part of what happens in schools is that child, whether it was written or verbalized or a peer reports it or they say it while they're with you, is gonna be that we, of course, maintain calm, and we follow our assessment protocol, which I don't want to get into all the details, but we're looking for lethality. Do they have access? Do they have a plan? Was there a trigger? Is this the first time you've had these thoughts, or is it a recurring issue, which will help us determine the level of response we want to provide. Do we want to respond in a low level, a mid-level, or a high level? And a high level would look like what Dr. Gordon Young was describing as far as making a referral for potential emergency room assessment, which is a follow-up assessment to determine, do we need to go inpatient? Do we need to make a referral for outside therapy and counseling? Is there a mental health condition that we're unaware of that we need to potentially diagnose? Are there environmental triggers that we can make a safety plan to address? Do we need to restrict some of the items that student or adult has access to? There's a lot of ways that we can respond, but it's good for you all to know that there are people who are trained that you can get quick access to in an emergency situation that is going to know how to respond. So while internally we're feeling potentially panicked and a little bit distraught, we want to project calm and that we have a way to respond to this, and that we're going to reach out and get help and not keep it in the home, and not ignore or invalidate that person's response and how they're communicating.
I want to piggyback on that because I think you both brought that up, is that the best thing you can do is always check yourself, because your response of fear will spark and trigger them even more. And so I like to tell a lot of my clients, if they feel family members, is to practice. Practice how you respond if someone came up to you and said, I no longer want to live, or I'm gonna give you my 1964 Cadillac that I love so dearly, I'm gonna give it to you. And so those are telltale signs. But practice how you would engage with that person, because you don't want to trigger them even more. You always want to be non-judgmental, as Dr. Young said. You want to not be judgmental. The best thing is to just be there to listen, support, because most of the times what we do is, oh, nothing's wrong with you. It's not that serious. Say stuff like that. Those are trigger words for individuals that are suicidal. So we want to be extremely careful on what we say and how we project ourselves to them, because it's going to be us to push them over the edge, even if they're not to the edge.
Can I just say this really quickly to that point? Because I see people do this a lot. They start identifying materialistic things that the person owns as though that is enough for that person to want to live. Well, you have a beautiful home. Think about your job. Those things don't matter to that person in that space at that time. That can be a trigger.
And one other thing I wanted to add was the biggest emotion for youth, and it could be adults too, but I work with youth mostly, is to feel like a burden. Nobody wants to feel like a burden. And so we have to be careful with our language to our youth. And when we're in a space of frustration that we haven't checked in, that we pause, not say the first thing that comes to our mind or our heart, and if we need to withdraw a little bit, get ourselves together, and then come back to the conversation, that's always an option. But to really avoid making a youth or a person feel like a burden. That is one of the biggest triggers to suicidal thoughts and feelings.
Thank you. Just a couple of things, and then I'm going to come to each of you for final thoughts in these final minutes. One of the things, Denise, who taught the signs and symptoms session today, she's also trained in what we call mental health first aid, and I just wanted to share with everyone, we'll be planning some mental health first aid trainings here at St. Paul in the future, where you learn about signs and symptoms of not only mental health, but also individuals at risk of committing suicide, but also how to respond, teaching you how to respond. And so to look for that. And then we also talked about the crisis. One of the presenters, Mr. Ryan Hobson, in the immediate crisis, one of the things his area of expertise is he works for the mobile crisis response. When individuals are in crisis in the moment, there's a mobile crisis response number that you will see on the screen, and that calls out professionals such as Mr. Hobson to come out and to be able to de-escalate and help individuals work through that event that is occurring. So one of the things I want to do in the last 2 to 3 minutes that we have, just give each of you an opportunity just to share final thoughts.
Okay. I guess what I'm hoping that everyone can leave here with is what I talked about, the emotional cost of caring. Most of us care about people, but not to lose sight of caring about yourself. Check your own mental health. And that can change, and understanding the capacity in which you are able to carry. Your capacity, your 100% is going to be different from day to day, right? And then, surrounding yourself around people who understand that you may not always have the capacity. Sometimes we're not okay, but when you are the strong one or you're the dependable one, everybody comes to you, and just being mindful of your own room that you may or may not have. And so that way you're taking care of yourself in order to be able to take care of those around you. So self first.
That's awesome. Actually, that was similar to what I was going to say. But I want to get a little bit deeper with the men, because what Doc was just talking about, the emotional intelligence piece of it. Being able to tap into your emotions, being able to know what those emotions are, and also being able to recognize the emotions of other people. A lot of men don't do that. I don't know if you guys noticed the demonstration that I did earlier. We had one male, all of those women. Yeah. That's how it is. Men struggle with tapping into their own emotions because they don't feel safe. And so for any leaders around here that's in here listening to me today, find spaces, safe spaces for men to be vulnerable, to grow a brotherhood, to be able to establish some type of stability in their manhood, knowing who they are. We've heard the idea of we're not supposed to cry forever, and it's still going on today. We need to tap into our emotions because it's ruined, because I'm a marriage and family therapist as well, it's ruined our relationships because we don't know how to communicate with our significant other. Communication goes beyond just talking. It goes beyond just showing up. So we have to be able to communicate. We have to be able to tap into our emotion, and we have to have these safe spaces for men to be men.
100%. The one thing that I would like to leave you all with is, and this is for youth to adults, is just starting to spend time recognizing your triggers. Whether it's a trigger for anxiety, whether it's a trigger for stress, whether it's a trigger for depression, just really taking time to identify what spikes stress or anger or frustration or sadness or worry in you, and then making a plan for how you can manipulate and change the conditions so that you can adjust to whatever triggers are going to come. Because you can't always manage the trigger, but once you recognize it, you can manage your response to the trigger or your access to the trigger or its exposure to you. And so that will empower you so that you're not avoiding the trigger, because that can create some behavioral and cognitive challenges for anybody. And so once you recognize it, come up with a plan on what you can do to manipulate it or respond to it better emotionally. Because if you don't recognize your triggers and you're spiked emotionally, you're going to have reactions that might damage relationships or employment or other areas of your life. And that's when we start to see things mental health-wise get intense, because we are just walking around blind because we haven't acknowledged and targeted what our triggers are and communicating those. That was a key, turning point in my relationship with my wife, is making sure I understood my triggers from past traumas and hers as well, and understanding them and sharing them and mutually working on plans to address them so that life works more smoothly. Not just for us, but for our children and for other folks that we interact with. So it's a huge piece that we can all be doing.
Thank you. So I want to first thank each of you for coming out, being a part of this Mental Health Summit Beyond the Label, taking an interest, understanding how important it is, not only in our personal lives and our families and our loved ones, but throughout the community. But I want us all to take the time to thank all of the volunteers that helped pull this together to make this morning and afternoon go smooth. Let's give our volunteers a hand. Justin on our audio visual, let's give Justin a hand. Appreciate that. And then our presenters that presented, I want to especially thank all of the presenters were great. I especially want to thank the presenters from Trillium Place V, a social worker at our crisis center, and Denise and Annette and Ryan and Pastor Randall and Dr. Bernice Gordon-Young. Let's give our presenters a round of applause. And last but not least, I really want us all to thank Pastor Hubbard. One of the things Pastor Hubbard has allowed in this, helping us normalize the conversation around mental health, and how mental health is just as important as our spiritual health when we're talking about treating the whole person and bringing these conversations to more normal settings. And this is just the beginning for us to have these conversations and for us to take this information and share it in the community. But let's give Pastor Hubbard a round of applause. And with that, we're going to get out of here on time. I want to say thank you. Enjoy the rest of your weekend, and continue to take care of yourselves as we take care of others.